Welcome back. You're still watching the South African Morning. People living with HIV continue to be stigmatized, and the South African Network of People Who Use Drugs says this often gets in the way of them adhering to treatment or seeking psychological help. Dr. Andrew Scheibe, an advisor at the organization TB HIV Care, is an expert on the negative impact of stigma in dealing with this disease. Doctor, thank you very much for your time. So South Africa has made commendable gains in the fight against HIV and AIDS with one of the most thorough and far-reaching community healthcare campaigns globally. But what have been our gains in terms of removing the stigma attached to the virus?
So I think we have made gains just in the fact that so many people have now tested and many people are aware of their status. It's incredible to note that we have the world's largest HIV treatment program. However, many people are also accessing life-saving antiretroviral therapy, which we now know is able to give people a very long, fulfilling life, and it's now viewed, if you're on treatment, as just a chronic disease. So I think those are really significant advances to know that from a medical perspective, that if people know their status and they need to go into treatment, people can live really healthy, long lives. And we also have very effective prevention interventions. So I think there is a lot of really positive gains that have been made.
The next question then also is, and has to be, what do we still need to do? Where have we failed people in removing that stigma?
So I think there's still a lot of stigma linked to HIV generally and also to TB. There are a lot of misunderstandings, and often they go hand in hand. Because HIV affects the immune system, it also makes people who are living with HIV more vulnerable to tuberculosis. And there's a lot of TB-related stigma. And what stigma does, I think, it affects people's view of self. It can affect people's sense of belonging. And if there is witnessing of other people being stigmatized, it gives this fear of the consequences of disclosure. And what that often means is people, even if they might be at high risk for HIV, they don't test. Or if people know that they're HIV infected, they don't go into treatment. So one of the challenges that we're having to grapple with is how do we really also support people who are on treatment to stay on treatment. And that involves also some of the healthcare worker perspectives, the community's perspectives, to really be supportive and inclusionary. And what we do know is it's often people who are marginalized, people who are poor, people, particularly young women and girls who are at high risk from factors that are often out of their control. And what COVID has shown us is particularly how vulnerable people in our society really face the brunt of many health conditions. And we've been working specifically around people who use drugs, and there's a lot of stigma and discrimination around people who use drugs. And it's often based on a misunderstanding of what drugs are, why people take them. There's often a view that drugs are bad or that people who use drugs are bad, and that's simply not true. And in that context, if people are stigmatized, are excluded, they don't then feel a sense of well-being, a sense of wanting to think of a future, and that can also translate to them not testing for HIV.
I'm glad you talk about COVID-19 because the pandemic has pulled focus in a lot of ways. We've seen people suffering from long-term conditions, not accessing treatment as frequently as they have, which you have mentioned. What we've also seen during the pandemic is stigmatization of healthcare workers. How does that play into their ability to effectively do their work, and how does removing the stigma capacitate healthcare workers to make sure that those on regular antiretroviral treatments stay on those drugs?
So I think what's important to note about stigma is that it's pervasive, but it's a behavior and a factor that can be changed. And there are often two components. One of them is what we call self-stigma, and that's what people think about themselves. And that's often linked to society's perspectives of a behavior that might, from a myth perspective, be the result of why someone, for example, might have contracted HIV. And that internal stigma is particularly important for people at risk for a range of conditions. And I think the internal stigma component is not so relevant in the health worker setting. But there is then the other kind of stigma, which is that external stigma, that stigma towards other people who have some kind of condition. And I think stigma towards healthcare workers might be around the fact that we want to separate ourselves for them because they might be at high risk of passing the COVID infection, the coronavirus infection, onto other people. And what we have to understand is that healthcare settings themselves are not notably high-risk areas for transmission because there are so many protocols in place for controlling infection. So COVID is just another infection that the health settings have to take into account. Not to say that there haven't been infections among healthcare workers, but it's a much lower risk than, for example, if people are in community settings or in religious groupings where people are very close together, where there's a much higher risk of infection. And it's that internal perspective and perception that people have of, where is a high-risk space? And generally, health facilities are not high-risk spaces. So it's very important for people's general well-being to continue to access their medications, to continue to do the things that keep them healthy, and to recognize that, if anything, healthcare workers are some of the most aware of how to reduce the transmission of infectious diseases. And I think just to know that stigma is always a bad thing, and we all are prejudicial around some things, and I think we all can do better on thinking of the way that we think of others and of ourselves to try and address stigma. Because from an HIV perspective, and it applies to many things in our society, which is so segregated and exclusionary, is we want zero stigma.
Thank you very much for your time. As always, Dr. Scheibe is an advisor at the organisation TB and HIV Care.